Hi guys, Dr. Loretta here. So by the end of this video, you're going to learn how to stop worrying because with continual worrying, it can become habitual and become your default mode. Also, you develop a higher likelihood of developing or worsening mental health disorders such as anxiety, depression, increased level of stress, and other stress-induced physical ailments such as diabetes and high blood pressure. The most common mental illness in America is anxiety. Anxiety is an issue that deserves attention as it impacts everything from workplace performance to personal relationships. Anxiety disorders are the most common mental illnesses in America and affects about 40 million adults or 19.1% of the population. According to the US Census Bureau Household Pulse Survey, nearly one-third of adults reported anxiety and depressive symptoms in 2023. Anxiety disorders are also the most common mental illnesses in the world, not just America. Roughly about 301 million people, with an estimated 4% of the global population, have anxiety disorder. Anxiety can be normal in certain circumstances like before an interview, a test, or a presentation. Every human needs some level of anxiety to function. Anxiety comprises of multiple symptoms, one of which is constant worry. It is normal for the human mind to worry about things. However, worry can quickly become problematic when it becomes persistent and consistent, when it starts to affect or interfere with your life, affect your ability to focus on your job, affecting your sleep, your appetite, distracts your focus from things that require your attention, and difficulty concentrating. Worrying is usually on the negatives and never on positive things, which makes worry even more problematic. Think about the last time you worried about something. One of three things happened. It either did not happen like you thought it would, like a negative turn of events, or it happened but not to the magnitude that you thought it would, or instead, a plus came out of it. For example, you had a meeting where you challenged your boss, and your boss tells you to see them in the office the following day. You worry from that moment till you meet that boss and you walk in and the boss congratulates you on a promotion because your idea in that meeting showed them a different perspective. Or the boss tells you that it wasn't okay the way you challenged them, that next time it would be more appreciated if you brought the idea to them before the meeting. Or they just give you a warning and you did not get fired like you thought you would. The dictionary definition of worrying is causing anxiety about actual or potential problems. In parentheses, alarming. Too many times I hear people tell themselves to stop worrying or tell others stop worrying. Now let's practice something. I'm going to tell you a word and then you need to stop thinking about that word. And let's see how that works. Oranges. Now stop thinking about oranges. Did you really stop thinking about oranges? No! Instead, you thought about oranges even the more. When you worry about something, it goes to say that it is something that is important to you. So using distractions can be helpful in the short term, but in the long run, it causes worrying to persist. Using distraction can be an avoidance mechanism, and avoidance over a period of time breeds further avoidance. When you push that worry thought away using distraction, it only schedules that worry automatically for the minute that that distraction is gone. While some people who worry excessively seek relief in harmful lifestyles or habits such as overeating, cigarette smoking, using alcohol and drugs which are unproductive, now here are more practical and evidence-based ways to manage worry thoughts. 1. Awareness. The first step in problem solving is to identify the problem. First, identify that you worry. You cannot treat what you do not know. You need to first name it to tame it. You might ask, how do I know that I worry? Here's how. Worrying can trigger the stress response, namely the fight or flight response, which causes the sympathetic nervous system to release stress hormones such as cortisol. These cause physical reactions such as dry mouth, dizziness, increased heart rate, fatigue, headaches, irritability, muscle tension, uneasiness, and nausea. There are three-part component model to create awareness. 1. Thought. 2. Emotions. And 3. Physical reactions. In cognitive behavioral therapy, it is said that your thoughts affect your emotions and those emotions in turn affect your behavior. If you experience any of the above physical reactions, then ask yourself what emotion is in question, and then identify what thoughts are assigned to that emotion. If you have a hard time identifying your thoughts, then ask yourself, if someone could hear what's going on in my mind, what would they hear? Properly identify each component. It helps create awareness, which in turn helps you rationally approach it. 2. Get your facts. Worrying is based on assumptions of what we think the possible outcomes will be, and we assume. And you know what they say about assumptions? When you assume, you make an ass out of you and me. Example, you have persistent headache that is probably not resolving with Tylenol. It is normal to be concerned. Instead of searching Google or Wikipedia to find answers that could potentially fuel that worry, because I am most certain that you would see something that would say that you have a tumor. But instead, talk to your healthcare professional who would run labs, scans, whatever the need be to properly diagnose what the problem is. It could just be dehydration, low sodium level, or something even minute. Or even if it is a tumor, at least now you're in the care of professionals who would treat it, which is something that your worrying would not afford you. 3. Ask yourself the difficult question. When you're worried about a situation, ask yourself, is this something within my control? If it is something that you have control over, then start problem solving on how to navigate that situation, focusing on that area of control. Example, you have a presentation coming up. You do not have control over people's mind on how they choose to be receptive of that presentation, but you can focus your energy on doing your research, writing your presentation, and preparing so that you give an excellent presentation. Something that you fully have control over is you have a test and you're worried that you would fail. You focus your energy on studying way ahead of time so that you're very prepared for that exam. However, if the answer is no, then write down aspects of that situation that you have influence over. The fact that you do not have control of a situation does not mean that you cannot influence it. Example, you are worried about how your children would turn out in the future. You do not have control over the choices that your children will make in the future. However, you can influence it by giving them the best education, teaching them good morals, values, manners, with hopes that they will turn out great. Another example is the weather. Being worried that it's forecasted to rain. However, you can make sure to dress weather appropriate, have your umbrella with you, have your car with you, put measures in place to make sure that when that rain comes, it does not affect you adversely. Worrying about that rain is not productive. It is just eating away from your mental strength and your ability and focus to problem solving. When we focus our energy on worrying, we think that we are problem solving, and we think that if we do not worry about it, then we are not taking it seriously. However, what worry does is that it keeps us stuck, does not proffer solution, and leaves us with more possibility of a negative outcome. 4. Identify it. Properly call them for what they are. They are just thoughts. Note and remind yourself that your thoughts are not always facts. The fact that you think it does not make it true. 5. Challenge the thought. Most of our worry thoughts are irrational. With challenging those thoughts, it helps you take a step back and consider the situation and thoughts from a different perspective, such as from a neutral body. Each question is designed to lead you to look at that negative thought more objectively. Here are questions to use in challenging that thought. 1. What is the evidence for or against that thought? 2. Are you interpreting this situation with incomplete information? 3. Is thinking about this situation in the manner that you are helpful? 4. If the situation plays out the way I think it might, how would I cope? 5. What are other interpretations of this situation? And 6. Reframe negative thoughts. 6. Exercise is an effective way to train your body to deal with stress under uncontrolled circumstances and slow down your thoughts to be able to rationally tackle them. Before we get to the last 2 points, if you are yet to, please take this moment to like, subscribe, and share with your friends and your loved ones so they can join us on this journey to mental wellness. 7. Relaxation technique. In a heightened state of worry, it can be hard to slow your mind down and logically address the situation. Relaxation increases blood flow to the brain, which puts you in a psychological state of mental alertness and clarity, calming your mind down and reducing worries. Engaging in relaxation techniques can reduce the negative effects of stress and improve your mood. Some of these techniques would be deep breathing, listening to music, yoga, grounding techniques, and meditation. Meditation helps you focus your attention on what is happening in the present moment without thinking of the past or the future. Meditation decreases hormones such as cortisol and adrenaline, which are released during the fight or flight or stress response. 8. Journaling. Make it a duty to write down whatever thoughts you are having, most especially before bed, to offload your mind and help you fall asleep without ruminating on thoughts. Seek help. Talking to a professional is always an answer, most especially when this worrying is affecting your life. With a therapist, you're able to identify your core beliefs, properly label and understand your thoughts, and develop coping strategies to deal with those issues that trigger excessive worrying. You can never go wrong with therapy or in the hands of the right therapist.